Welcome to our webinar, our Tuesday talk on Medicare Open Enrollment, last minute information for 2021, which is really to make changes to your 2022 Medicare. So, welcome. We're glad to see you. So I want to run first through some of the basics of Medicare for those who are brand new into the Medicare world, or for people who are here for parents or others who they're trying to help through this process. It helps just to kind of know what the Medicare rules are. And I've also given you in this outline, which you'll get after the presentation, what the 2022 numbers are for deductibles and copays and things like that. So first, there's Medicare Part A. And Part A is what most people get free because you've paid into the system your whole life. And Medicare Part A covers hospital, hospice services, some but not all home health care, and SNFs, SNF, that means skilled nursing facilities. Not a lot, but some. So for hospital coverage, going into 2022, the out-of-pocket is $1,556 for the first 60 days. After that, you have to pay $389 a day for days 61 to 90, then $778 per day for days 91 to 150, and in full after day 150. So that's one reason, hospitals try to move you out as quickly as possible. It gets very expensive once you hit a long stay in the hospital. Hospice is coverage that can be for only, typically, if you are very ill and you have up to 6 months to live, and it's just to try to make your passing more comfortable. For home care, it's only skilled home care. That means you need therapy, or you need rehab, or you've got feeding tubes, or you have oxygen, or something like that, that makes you a step above just ordinarily everyday care being provided at home, like home caregivers. That's private pay, but the skilled part of it, if you need that additional medical treatment, then Medicare can pay some or all of that. In a skilled nursing facility, you have to have an admittance, which is a stay at a hospital under Medicare Part A, not an observation stay, which is actually paid under Medicare Part B. If you have an admittance and you're there for at least 3 midnights, how they count days, and a total of 72 hours, when you transfer to a skilled nursing care, but a skilled nursing facility, because you need additional skilled care like oxygen or tube feeding or therapy or rehab, then, and the nursing home accepts Medicare, it'll pay for medical coverage for room and board up to 100 days. The first 20 days are paid in full by Medicare Part A, and days 21 to 100 are paid in part with a copay that you have to pay or your supplemental insurance has to pay if you've got traditional Medicare, which I will kind of explain as we go. They try to kick you out of the nursing home as quickly as possible. I have noted there's something called JIMMO, J-I-M-M-O, in the first point under skilled nursing care. That's just the name of a lawsuit that was filed about 2011. And the JIMMO case says that they can't kick you out because you're not improving, or that you've plateaued, or you're failing to progress. Skilled nursing care will try to kick you out after that 20 days paid in full by Medicare A as quickly as they can, because the reimbursement rates that they get from Medicare for those days that you're there start to drop after the first day. It's pretty high at first, and it starts to drop after even just a week. And so the nursing homes are trying to move you on so they can bring in somebody else at the higher rate of reimbursement from Medicare. And they say that you can't stay unless you're improving. And that JIMMO case said that isn't true. You can stay for up to the 100 days as long as a doctor says it's medically necessary for your maintenance or to not get worse. So with regard to these nursing home stays following a hospital stay, I tell people to appeal every denial. And if you need information about the JIMMO case and what they say, what the case said, and what nursing homes seem to ignore, let me know. And I've got a lot of information with regard to that. Okay, Medicare Part B is the optional coverage that most people go for. You kind of should have it. And this is the part where you pay a minimum premium. In 2022, the premium is going to be $170.10. It jumped a lot from 2021, mostly because of the new Alzheimer's drug that is terribly expensive. And they're anticipating people wanting that. So they've increased the premium to help cover the cost for that. So Medicare Part B pays doctor services, outpatient care, home health coverage, preventative services, you know, when you go to see your doctor. For Part B, there's a $233 deductible in 2022, and then you pay 20% of the cost over that unless you have the supplemental insurance. So when you have Parts A and B, you have traditional Medicare. And traditional Medicare will cover you nationally. It's a federal program, so it covers nationally, but it doesn't cover overseas. You have to get special coverage for that. And if you have traditional Medicare, then you have to have traditional Medicare A and B and a supplement and a Part D prescription plan, which I'm going to talk about talking about here, Medicare Advantage. Medicare Part C, it actually is called. Medicare Part C is the Medicare Advantage program. It's an alternate to traditional Medicare, and it rolls together the A and the B and the supplement and the prescription plan in something like an HMO type coverage. The premium, you don't typically have to pay a premium extra for Medicare Medicare Advantage plan. It's usually paid by your Part B premium, you know, the $170 this coming year that you have to pay out of your Social Security check. But there are some plans that cost more. That's part of the looking at the open enrollment time and what you want to pay for a Medicare Advantage plan. One of the reasons people like Advantage plans is it can include also not just medical coverage like Medicare does, but vision and dental and hearing and fitness programs and things like that. So it rolls a lot into this program. One of the problems though with Medicare Advantage is that it's local in-network coverage only. So you have to see doctors in that network of your Medicare Advantage plan. There's pre-certifications necessary. It is not nationwide. So if you move to a new, even in Ohio, if you move to Southern Ohio, you're going to have to find a new Medicare Advantage plan because they're very localized plans. And if you move out of state, then it definitely doesn't cover. You're going to have to, you know, look at something new in that state. So, or if you're on vacation at some part of some place other in the country and you have a car accident, the Medicare Advantage plan will cover emergency services, but only up to a point. And some of them will cut that coverage. They don't cover every single thing because you're not in network anymore. So I'm going to talk more about Medicare Advantage plans as we go through also. So if you have Medicare Advantage, everything's rolled into one. But if you have traditional Medicare, then you've got the A and the B, as I mentioned, and you have to have the supplemental health insurance or Medigap coverage. These are provided mostly by private insurance companies, you know, Anthem, Medical Mutual, different companies. And the supplemental health insurance is meant to cover where Part B leaves off. So Part B pays the, Part B only pays the 80%. And then this covers that annual deductible, it covers the overage above it. So you really need to have some type of supplemental health insurance plan if you are enrolled in traditional A, B, and then D Medicare coverage. There are all kinds of supplemental health insurance plans, plans A through E. They dropped F a few years back, and then G to N. They're all different. You have to evaluate each one individually as to what is helpful for you. And this changes every year during open enrollment. And even if your plan, you are happy with it one year, it may change or be wiped out when it comes time for open enrollment at the end of the year. So Medicare Part D, you need a prescription plan, Medicare prescription plan, if you have traditional Medicare. So you need A, B, a supplement, and then Part D. Those also, like the supplemental plans, are offered by private insurance companies. In 2022, they estimate the average monthly premium to be about $33 a month, but it varies, as does the Part B premium. The Part D premium also varies based upon your income. So the higher income you have, the higher the premium is going to be. And then Part D has this infamous donut hole. So for 2022, you won't have to pay more than $480 out of pocket initially. And then once your out-of-pocket costs hit $4,430, you're into the donut hole, where you have to pay 25% of your prescription costs until you've paid out-of-pocket $7,050, where again, you go into the catastrophic coverage and you have little or no copays. So this has never been a perfect system for prescription drugs. And that's why a lot of people have taken to going to Canada to get prescription coverage. And the healthcare is an issue that Biden is trying to address. So maybe this will change sometime. But it does change annually during open enrollment. And there are lots of plans out there that you have to pick each year to make sure that your plan that you pick covers your prescriptions. That's called the formulary. Each plan has a list of drugs that they will cover, and they're graded, I think, 1 through 5, and based upon how expensive they are. And you have to make sure your prescriptions fit into their formulary. And it changes from year to year too. Something that might have been on the cheaper end last year might end up being in a different category and cost you more when you go into the following year. So you got to look at that every year. All right, so now we get to open enrollment. So what is open enrollment? It's also called the annual election period between October 15th and December 7th. So we've been in it for a while, and we're running to the end here pretty quickly, which is why we wanted to get out some last minute information to everybody to make sure you're making the right choices. So during open enrollment, you can review and make changes to your traditional Medicare, your supplemental plan, your Part D plan, or any Medicare Advantage plan that you might be on. So it's the time to review all of the different options that you have for next year and make a decision. So you can change back and forth between traditional Medicare and Medicare Advantage. You have to be careful with some of those things, those changes. When we get closer to the end, I will go through some of the issues you really need to look at. Kathy asked, can you be denied coverage due to health problems? Good question. And when you're in initial enrollment time, so the first time you have to sign up for Medicare when you're 65, or if you have creditable coverage, if you have maybe employer coverage and it's the same as what Medicare would provide, and you're able to stay on that longer than age 65, when you do enroll in Medicare, there is no denial of coverage, even for a supplemental health insurance plan. You are guaranteed to get coverage. However, I'll just jump ahead in my outline. If you drop traditional Medicare and your supplement and you go to a Medicare Advantage plan because you think this is great, it's less expensive, there are some issues with it, and I'm going to get to that. But if you drop it and you go to Medicare Advantage, which rolls everything into one, and you're not happy with it, and you try to go back to traditional Medicare later than that initial enrollment period, then you are not guaranteed a supplemental coverage. So you might not be able to get back the supplemental policy that you need if you opted out of traditional Medicare into Medicare Advantage, and now you're opting back in. There are some high risk type of supplemental insurance policies available out there, but they're probably going to cost you more than if you were already had one in traditional Medicare and you never shifted to Medicare Advantage to begin with. Second, Jill has a question. Can you talk about going from Medicaid to Medicare at 65? I will be 65 in April. I'm currently on Medicaid. I don't have a clue what the transition will be. That is such a specific question, Jill, that it's not so simple to answer in this forum. But if you call the office, I'd be happy to kind of walk you through that, but I can't do it because not everybody's going through that same problem. All right, no problem, Jill. Okay, so in open enrollment, you are changing plans. You can choose a new Medicare Advantage plan, something different than what you had. You can join, drop, or change a Part D drug plan. And during open enrollment, it's a pretty long period of time. If you're searching through all of the options that you have, it can take a while. So if you say, well, this one sounds good, I'll enroll in this one. And you find out as you're continuing your search that it was not the best choice, you found something better, you can change your mind as many times as you want to during the annual open enrollment as you compare the plans. And once you decide on one, it takes effect on January 1st. Okay, but what if you missed annual open enrollment? Is there a second chance at that? So there is a second time frame most people don't pay attention to called Medicare Advantage open enrollment period. And that runs from January 1st through March 31st. So if you are on a Medicare Advantage plan only, during this additional time period, you can switch to another different Medicare Advantage plan or back to traditional Medicare. And then you've got to pick your supplement and your Part D plan. And again, there's that issue with the supplement and trying to get it back again. This is kind of a one-shot deal, though. If you screwed up and you needed to switch plans, then you've got time during this window just to make one more change. And in that case, then the insurance coverage begins July 1st. Okay, so here are some of the issues that I see with clients having to do with open enrollment every year. It's a pain in the butt to begin with. And most people don't review their choices and they just keep the same coverage every year. It's much simpler to do that. You don't have to look at all the options that you have. And that's complex. For 2022, there's 39 Medicare Advantage plans that you have to look at to see which one is right for you. That's double how many there were in 2017. And I believe it's just going to continue to grow. And there's 54 Medicare Part D plans if you're on traditional Medicare and you have to decide on a new Part D plan for the following year. That's a lot. And you've got to look at all the formularies and make determinations about what plan covers your drugs that you need. So there's so much information out there. Also, when you're signing up, I kind of alluded to this earlier. If you don't need Part D because your employer is covering it, make sure it's creditable coverage, because if you then have to start a Part B plan, if it's not creditable towards Medicare, then you'll pay a higher premium. You pay a penalty percentage higher amount to get Part B, and the same thing for Part D. So if you're in that situation this year for open enrollment, make sure that you've got the right coverage through your employer so that you don't have to pay this higher premium. And I already mentioned, if you're dropping Medicare Advantage for traditional, you might not qualify for the supplemental insurance. So think hard about that as well. Something that's going on now more frequently, it started a few years ago, but now it's beginning in the auto industry in particular. Auto industry retirees are being auto-enrolled in a Medicare Advantage plan. So the industry picks the plan for their employees or their retired employees. And if you don't like it, you have to actually opt out and change it and choose something else. Now, I have heard from a friend of mine whose husband is retired from this industry that the coverage is actually pretty good. But if you are the one or two people that are out there that need special kind of prescriptions or something important that's not covered on that Medicare Advantage plan, you might not want to choose that Medicare Advantage plan and opt into something else. So I got another question here. Oh, from Jill again. Can you give an example why you might not qualify for supplemental insurance? Sure, it's a health-related thing. So let's say that when you initially enroll in Medicare, you're guaranteed to get a supplemental insurance policy regardless of your health. So if you have cancer, if you have COPD, if you have, leukemia, well, I guess that's cancer. If you've got some health issue, you can always get the supplemental insurance when you first sign up. But if you drop out of traditional, go to Medicare Advantage, where it's all rolled into one, and now you're trying to go back to traditional Medicare, then that health issue you have can cause you to be denied for supplemental health insurance because you're not a good risk. You're going to be too expensive for them, so they won't take you. So that's why there are some insurance agents out there that will sell this high risk type of supplemental insurance, but it's going to be more expensive. And you got to think twice about going into Medicare Advantage if you've got a really good supplemental insurance policy, because you'll lose it and you probably won't be able to get it back unless you're in perfect health. And most people, as they age, don't become better healthy. They don't get healthier, they get sicker. And if you get sicker, you probably won't be able to get it again. So that is the answer to that. All right, so I want to give you my opinion, I guess, on Medicare Advantage plans versus traditional Medicare. The Center for Medicare and Medicaid, it's called CMS, is pushing Medicare Advantage plans. You'll hear everywhere about Medicare Advantage plans if you go to the Medicare website to get information, which is where they send you. There's lots of fact sheets. There's information on there. You can sign up for a My Social Security account, which allows you to get into, looking at Medicare options and things as well. But they're pushing these Medicare Advantage plans because they're cheaper for the government. The government doesn't have to fuss with health insurance. When you're on traditional Medicare, then when you get explanation of benefits form, they're from the government, they're from CMS saying, this is what you went in for, this is how much insurance covered, this is your copay and deductible and all of that. So they're paying the money out of the government coffers directly. When you sign up for a Medicare Advantage plan, the government pays that insurance company an amount. It's called a capitated amount. So they figure out that John Smith, during this next year, who signed up for the XYZ Medicare Advantage plan, we think his expenses are going to be so much money, say $6,000 or $10,000 for the year, based upon his health and what we think. So here, XYZ Medicare Advantage plan, here is $10,000 to help cover John Smith. So the Medicare Advantage plan has $10,000 sitting there on his account. When he has a claim, they will evaluate the claim and pay it out if they think it's okay. What I have found, many Medicare Advantage plans will deny the claims, many claims, not just for something unusual, but even normal things sometimes. They will deny the claim, but if you appeal that decision, so that they put the onus on you. They're going to try to keep the full $10,000. The more they pay out, then the less they have left of that $10,000 and the less money they make on you as a patient. So they like to deny things. And if you appeal, you got about a 75% chance of winning that appeal and getting coverage, but they put the burden on you to make that appeal in order to try to get coverage. So they're trying to keep your money. And many Medicare Advantage plans also have caps on things, and they can end up being more expensive. People think they're cheaper because your $170 Medicare premium, which would go to pay Part B normally, and then you have to pay for a supplement. All you're paying for, in many cases, for these Medicare Advantage plans is the $170 premium. That covers it all. Well, this is great. This is cheap. It's only cheap if you are healthy and don't have any kind of major issues going on. And this happened with my dad, in fact. He had heart blockages. He had to have a quadruple bypass. And on the operating table, he had a bunch of microembolisms went to all over his body and had basically a big stroke all over the place. And at that point, he had been pretty healthy, except for this heart issue. And he said, I'm going to go with a Medicare Advantage plan because I don't want to pay all that extra money. So when this all happened, his physician came to me and basically said, look, he's on a Medicare Advantage plan, get him off of it. Even if you have to pay the 20% copays, it will be easier and less expensive for him to be back on traditional Medicare, even just A and B, because he would never qualify for a supplement at that point because he was really sick at that stage. And he said, even if you have to pay that 20%, it will be cheaper than fighting with the Medicare Advantage plan to try to get coverage. So they can end up being worse if you are really ill. So be careful if you're in a Medicare Advantage plan, ask a lot of questions. There are right now salesmen out there, like I call them the Joes, because it's Joe Namath and Joe, oh gosh, what's the other football player, that are pushing Medicare Advantage plans. There's also local salespersons. You probably get the mail, right? Starting in August, going on, hey, join our plan, join our plan. And a lot of the information those local insurance salespeople give you is misleading sometimes. It's incorrect. It's just trying to sell a plan because they make money off of you when they sell a plan. So it's a big problem. Ask for help. CMS doesn't care about you really. They don't help you automatically. You got to help yourself. If you feel like you've been wronged by one of the salespeople on television or by the local people who you've met with, or you're getting advertisement from, there is actually a special enrollment period that you can opt into if you've gotten screwed by choosing a Medicare Advantage plan or a prescription plan because of inaccurate or misleading information. There's actually a way that you can get out of it and get into something that's more appropriate. If you fell for somebody's sales pitch and it turns out not to be true, then there is an out. But again, the burden is on you to go out there and ask for that help and try to get out of the plan that you wrongly chose because it sounded like a good deal, but it turned out not to be. There are actually agents out there, insurance agents who are not tied to any particular insurance company that specialize in making these Medicare choices. If you don't want to spend the time, and I got friends in the category of having to make these choices now, and clients also who really spend hours researching all the options and picking the best plan for them or for their parents. But if you are not the kind who can sit down and do that, or you're not sure about what you're doing, there are insurance agents who specialize in making the right choice of which plan, whether it's traditional, picking the right supplement and the Part D prescription plan, or whether it's a Medicare Advantage plan and trying to pick the best one with all the options for you. And they don't charge you anything. Now, they get something from the insurance company as a payment for each person that signs up, but they are not the salesperson kind of. They are doing it to actually help you. And that's what their job is. And they're not allowed to advertise. None of these salespersons who sell, whether they're Medicare Advantage plans or Part D plans, are allowed to advertise. There is a fine line between advertising and giving good advice. And that's where people cross the line. I have a list of agents who do this, which I'm going to do when my day comes, talk to them about choosing the best option for you. And I'm going to stick with traditional Medicare, just from my personal experience and from those of my clients. So you really got to compare everything. You really got to think it out. And sometimes having somebody to help you out with that is a good idea. So compare and double check as you're going through all of this. And you still have time if you think you made a mistake on something, because it's open enrollment and not that next year's special Medicare Advantage open enrollment, you can still make a change on your plan. So do it if you need to. So with that, I thank you all for attending. If there's any other last minute questions, let me see if there's anything out there. Oh yeah, Kathy says, when you see plans that say 0 premium and they say you can put back money in your Social Security check, what is this? I think what those are mostly saying is a 0 premium means that Medicare Advantage. This is all going to be about Medicare Advantage. Either the Medicare Advantage plan itself doesn't charge you a premium. They only take what your Medicare premium for Part B would have been, the $170 and some change this coming year. I'm not aware of any plans that will let you like reimburse you that 170 that Social Security is going to take out anyway. It either goes to your Part B plan through traditional Medicare, or it goes to the Advantage plan if you're on Medicare Advantage. I don't know of any that would reimburse you, but there might be one out there. That might be a new thing. I've seen that too. And I don't believe it, because I'm just doubtful of all of these things after having lots of clients have lots of trouble, and my dad having a lot of trouble. And, you know, I see it out there, it's a problem. And my friends who have parents who are now going through open enrollment, trying to pick the right plan for them because they're just not able to do it anymore is a burden. It's hard. It's really hard. So any other last minute questions? I hope I answered that, Kathy. I'm not really sure exactly what they're meaning, but I would ask very pointed questions on what they mean about that. So I don't see anything else. So with that, I thank you so much for attending. And you will get a copy of the PowerPoint after the presentation, after we wrap up everything. And the video, the recording of the webinar itself will be available, and it'll be on our YouTube channel within probably a week or so. So with that, thank you all for attending. I'm going to stop sharing my screen so I can go back to the regular screen and say hi, and thank you so much from Solomon, Steiner, and Peck, and from me, and have a great rest of the day.